So before going into the patient's room and assessing them, I would do hand hygiene, and then I would ask them for their name and date of birth. So this video is an assignment for one of my classes. I will be turning it in for a grade, and the only people who will see it are my professors. Is that okay with you?
Yeah.
Great. Okay, my name is Kelsey. I'm a nurse practitioner student. I'm going to be assessing you today. I'm going to start out by just looking at your eyes. Could you take your glasses off for me? Before looking inside your eye, I just want to look at the external structure. So your eyes are symmetrical, your conjunctiva is pink, your sclera is white. I don't see any redness, swelling, or drainage. Any pain in your eye?
No.
Okay, great. So I'm going to go ahead and look at the internal structure of your eye. With my ophthalmoscope, just look over my shoulder. So I'm going to get real close. You okay?
Mm-hmm.
Okay, great. This side. You okay?
Mm-hmm.
Okay. Okay, so I was able to visualize the retina. I was also able to see the optic disc. It had sharp margins. It's able to see your macula and your fovea and the vasculature of your eye. I didn't see any hemorrhage or bleeding, and I did not see any wool bodies. It looked good. Your eyes okay?
Yeah, they're good.
All right, great. Next, I'm going to go ahead and look. I'm going to test your extraocular muscles. So just follow my finger and keep your head straight. Great. So your extraocular muscles are intact. We're looking at the oblique muscle and the rectus muscle of your eyes. Then we're going to go ahead and look in your ear. Any pain in your ear?
No.
Okay, great. So just looking at the external structure of the ear, it's not red. There's no swelling, no drainage, anything like that. Does it hurt when I tug?
No.
No. Okay, I'm gonna go ahead and pull up and out so I can look inside your ear. Sorry, I can pull on.
It's okay.
Great. Does it hurt when I tug on this one?
No.
Good. And same for this ear. I don't see any redness, any drainage. Good. So bilaterally, I was able to see her tympanic membrane. It was a nice gray color, both intact. I didn't see any redness, swelling, drainage in the canal. Your hearing's been okay?
Mm-hmm.
Good. I was also able to see cone of light and the malleus bone. So I'm gonna change, these out. Go ahead and look in your nose. You could just tilt your nose back for me. Great. Do you have any drainage coming from your nose?
No.
Okay, good. Her nasal mucosa is pink. It's moist. I didn't see any drainage. Any pain?
No.
No? Okay, good. Her septum is midline. I didn't see any blockages or anything like that. Then I'm gonna, change this out again. I was also able to see the inferior and middle turbinate as well, and they were pink and moist. Just open your mouth for me. Say ah. Looking at the hard and soft palate. Could you put your tongue at the roof of your mouth? Good. Any missing teeth?
Mm-mm.
Could you stick your tongue out and put it to the side? Other side? Good. Okay. Her oral mucosa, it's pink, it's moist. I didn't see any ulcerations, any lesions, any soreness in your mouth, any pain. Good, all her teeth were good, good dentition. Her uvula was midline. I didn't see any exudates on your pharynx or anything like that. So next we're going to palpate your lymph nodes. So if you just want to kind of turn this way a little bit. Okay, so we're going to start with the pre-auricular. Just tell me if there's any tenderness. And posterior auricular. Occipital. Tonsillar. Submandibular. Submental. And kind of turn your head that way. And with your sternocleidomastoid, we'll kind of look at the superficial cervical, this side, superficial cervical. Deep cervical chain, those are hard to palpate because they're so deep. Sorry, am I hurting you? Okay. Posterior cervical. And then supraclavicular. Great. Okay, then you're going to take your glasses off again. I'll just palpate your sinuses, so turn back that way for me. Frontal sinus, any tenderness, any pain?
No.
Maxillary sinuses, any pain?
No.
Okay, good. So with her lymph nodes, no adenopathy, no tenderness. I was not able to feel any of the lymph nodes. They weren't enlarged. I could feel them kind of moving a little bit, but nothing to be worried about. And then your maxillary sinuses and your frontal sinuses were good. No pain or anything?
No.
Okay, next we're going to look at your thyroid gland. So feeling the thyroid cartilage, cricoid cartilage, and then your thyroid gland. Any pain?
No.
Could you take a drink of water for me? I'm just going to feel your thyroid gland. Good. Okay, one more drink. Great. Okay, now I'm going to listen to the anterior portion of your chest. You can just stay there. Ideally, with a patient, you would want them to not have any clothes on, just their skin, as clothes can kind of disrupt the sound, but for modesty purposes, I'll have her keep her shirt on. Just take a deep breath when my stethoscope hits your chest. Flip around for me. Posteriorly. Feeling short of breath?
A little bit.
Almost done. Good. So both posteriorly and stay this way, sorry. Posteriorly and anteriorly, she was clear. No crackles, no wheezing, no rhonchi that I heard. And now we're going to do percussion posteriorly. And kind of hug your shoulder across your arms again. Good. Resonant sound throughout. Again, you would want them to not have any clothes on just so you can get a better sound. And when you are auscultating anteriorly, you'd also want a woman to lay down so the breast can be displaced so you can get a better sound quality. So, okay, thank you. Yep.